Today, I'm going to share with you the topic of dementia and Alzheimer. Initially, intro about dementia. Dementia is best understood not as a disease, but as a syndrome of progressive cognitive decline affecting higher cortical functions. The word progressive is the backbone of this topic. Unlike acute conditions like stroke, dementia begins subtly, progressive slowly, gradually destroys independence. What exactly is declining? Dementia affecting higher cortical function, which are almost advanced brain activities. Number one, memory, hippocampus, storage and recall. Executive function, frontal lobe, planning, decline, making. Then language, temporal lobes, speech and understanding. Behavior, limbic system, emotional and personality. So, dementia is not just forgetfulness, it is global brain dysfunction. Then, critical clinical concept. Dementia must be differentiated from normal aging. The normal aging means mild forgetfulness but daily life intact. Delirium, acute, reversible, fluctuating confusion. So, finally, in a nutshell, dementia is the chronic, progressive, irreversibly. It's usually. So, it is the mental disorder caused by change in the brain. Patients with dementia are confused and disoriented. Confused person, place, or time. Dementia is not just a normal change of aging. It is the impairment of brain function that interferes with routine daily activities. Then move on to the next slide. There are many causes and type of dementia. Number one, reversible. Number two, irreversible. Then other some of the causes. First, reversible. Reversible may be caused by vitamin deficiency, metal poisoning, or depression. Irreversible may sometimes be controlled by treatment or medication, but not cure multi infarct, dementia, Alzheimer's disease. Then, third, other illness or diseases that can cause dementia, AIDS, brain injuries, tumor infections. Then, move on to the next slide. Multi-infractive dementia. Initially, we see reversible, then irreversible. That included the points reversible dementia, the don't miss diagnosis. This is extremely important in exams and clinical practice. Common reversible causes, like already we discussed, vitamin B12 deficiency, it causes impaired nerve conduction, then depression, then hypothyroidism, drug induced. The drug induced includes sedative, anticholinergic. Then clinical trick, if dementia symptoms are suddenly or fluctuating, think reversible cause first. Then irreversible dementia, it consists permanently lost. So no cure, no management. Then now we are discussing multi-infarct dementia. It's vascular logic. This dementia is caused by repeated ischemic insult to the brain. The pathophysiology, small blood vessels get blocked, leads to microinfarct. Each infarct localized brain damage over time, cumulative loss, congenital decline. Unique features, unlike Alzheimer, decline is stepwise, not smooth. Patients suddenly worsen after each stroke. The risk factors include hypertension, diabetes, arteriosclerosis. So, prevention equal to control of vascular risk factor. Then Alzheimer disease. Alzheimer disease is the most important and most asked topic. It's primarily degenerative brain disorder. Which part brain is affected first? Initially, the hypothalamus. It's also called memory center. That's why earliest symptom is recent memory loss. Then the progressive pattern, memory loss, language impairment, judgment decline, motor dysfunction. This progress reflects spreading brain damage. Then, age and genetics. Age, most important risk factor. Why is the age is the most important risk factor? It is most important because on coming to age, it reduces the neuronal repair, increased oxidative stress. Then genetic, key genes, APP gene, amyloid precursor protein, persilin 1 and 2, APOE alleles, very important exam point. APOE sigma 4 increases the risk significantly. Most people with Alzheimer's disease are over age 65, although it can affect people as young as 40. The youngest case recorded 28 years old. Statistics 65 to 74 year olds, 3% of population has Alzheimer's disease. Then 75 to 85 years old, 19% of population has Alzheimer's disease. Above age 85, 47% of population has Alzheimer's disease. Then the duration and outcomes. Alzheimer is slowly but relentless. Long asymptomatic phases, gradual function decline, eventual death. Important, death is usually indirect due to experiential pneumonia, bed sores, it called as infection, then malnutrition. From onset of symptoms, the disease can last anywhere from 3 years to 20 plus years. The average lifespan of a person with Alzheimer's disease is 11 years. Alzheimer's disease is a terminal disease. It is the fourth leading cause of death in American adults. More than 50% of all nursing home residents having Alzheimer's disease. Then move on to the next slide. Then these are the flow chart of persons having Alzheimer's disease and its percentage or overview. Just have a quick glance of view on this topic. Then move on to the next slide. Causes of Alzheimer's disease. This is the heart of Alzheimer's disease. The cause of Alzheimer's disease is not known because it's different theories, genetic, and etc. Researchers know that having a close relative with an increase a person's risk of developing the disease. At age 80, a person has a 50% risk of developing Alzheimer's disease. A person with 1% of parent having the disease has a 36% higher risk. A person with two parents having the Alzheimer's disease has a 54% higher risk. Studies have shown that people with familial Alzheimer's disease have a defect in chromosome 21. The chromosome 21 has the gene for the development of the protein that causes the flakes deposited in the brain in Alzheimer's disease. Down syndromes also cause a mutation in chromosome 21. If a person with Down syndrome lives into their 40s, they almost always develop Alzheimer's diseases. Then, the pathophysiology of Alzheimer's disease. Number one, Amyloid flake extracellular derived from APP protein abnormal cleavage of beta amyloids. These flakes accumulate outside the neuron and it block synaptic transmission. The number two, neurofibrillary tangles. It called as intracellular and amyloid flag is called as extracellular. This intracellular made up of tau protein normally stabilizes microtubules. In Alzheimer's, tau becomes abnormal, forms twisted tangles, result neuron structural collapses. The number three, neuronal loss. Final outcome, the brain shrinks. It refers as cortical atrophy, ventricular enlargement. Then the clinical link, more flake plus tangle is worsen the congenitive decline. Then the environmental factor, studies with identical twins shows environment does play a part in developing Alzheimer's disease. Researchers do not understand why or how people who have suffered head injuries with loss of consciousness develop Alzheimer's disease at 3 times the rate of other adults. Aluminium researchers have discounted the investigation of aluminum salt as a cause of Alzheimer's disease. Then virus. Researchers is being done to see if Alzheimer's disease is triggered by a hidden virus. Studies also show that the following factors can affect a person's risk of developing Alzheimer's disease. The geographic area where you live, higher in Goa, your mother's age at your birth. Studies have shows that Alzheimer's disease patients have physical changes in the brain. Initially, loss of brain cells, that's neuron, then development of tangles and flakes. Listen carefully the healthy brains and the Alzheimer's disease brain. In Alzheimer's disease brain, it shows or we diagnoses the flake formation and tangles. Earliest sign forgetting recent conversation, repeating questions, and misplacing items. Recent memory is affected first because hippocampus is damaged first. These are the signs and symptoms of Alzheimer's disease. Alzheimer's disease has a gradual onset. The first clue is a change in the person's behavior. Mild forgetfulness leads to problems finding the right word. Then that leads to inability to recognize objects. That leads to inability to use simple words. At first, the only symptoms may be mild forgetfulness. Then, people with Alzheimer's disease may have trouble remembering recent events, name of familiar people, math problems. The person may be able to hide the problems from family at this point. It may take months for the family to notice something is wrong. Eventually, friends, family, or co-workers starts to notice things like increasing and persistent forgetfulness, mild personality changes, minor disorientation, frequently losses or misplaced familiar items, has mild difficulty finding the right word, has mild difficulty performing familiar tasks, disorientation of time and place, poor or decreased judgment, loss of initiative. Then finally, difficulties performing arithmetic calculations. Then the diagnosis of Alzheimer's disease. Clinical integration. No single test diagnosis of exclusion. Alzheimer's disease is diagnosed by exclusion. Steps in the diagnostic process. Medical history, the doctors gathers pertained medical information. It include illness, operations, family history, nutritional and lifestyle information. Number two, physical exam. The doctor performs a competitive physical exam. The number three, neurological exam. The doctor will order special tests like such as a brain scan, ECG, or an MRI. Psychological examination. The doctors will refer the persons to a psychiatrist. Laboratory tests. The doctor will have lab work done to eliminate other possible diseases. Evidence of characteristics of Alzheimer's disease. The doctor will took the time frame for the confusion and behaviors of the person. If everything else is ruled out, then the doctor will make the diagnosis of Alzheimer's disease. The only positive diagnosis is made with the microscopic examination of the brain tissue. This can only be done on autopsy. The other investigation process like MRI. MRI is for brain atrophy. Then ECG, slow brain activity. It can be investigated through the ECG. Then blood test rule out reversible causes. Then the cognitive tests like mini mental state examination, it's called as MMSA. Then the gold standard brain biopsy, that's called for post-mortem. Then the early stages of Alzheimer's diseases. This stage can last for 2 to 4 years. A person in this stage may be aware of the diagnosis or know that something is wrong. A person in the early stage may still be able to participate in decisions affecting their future. Then, last, medication used for Alzheimer's disease try to prolong the early stage of the disease rather than cure it. The patient knows something is wrong, tries to compensate, then emotionally they feel anxiety and frustration. Mild stage caregiver burden faces. The behavior associated with the early stage, mild forgetfulness in aim, what has been said, recent events, then difficulty progressing new information, learning new things, following conversation, then problems with orientation, becomes easily lost, trouble following directions, then date and time. The early stages, communication difficulties, finding the right words, using proper grammars, pronouncing words, disinterest in grooming, overreact to stress. The mild stages like now the disease became visible to others, personality changes, aggression, bandering, very important. These stages cause maximum stress to caregivers. This stage may last from 2 to 10 years. This is the stage where some people with Alzheimer's disease become restless, and pace off wandering. People in this stage may need help with many daily tasks, dressing, bathing, using the toilet. Caregivers may have difficulty as care becomes more difficult. Then, the behavior associated with the mild stage, continued memory lapse, forgetfulness about personal history, then inability to recognize friends and family. Personality changes, confusion, anxiety, suspicions, sadness or depression, hostility. Then mild stage, declining concentration abilities, restlessness, facing, wandering, repetition, delusion, aggression, assistance required for daily tasks, appetite fluctuation. Then the last state. This is also called as the terminal phase. Brain function is severely damaged, can't speak, can't swallow, and can't move. Patient become bedridden, fully dependent. This stage usually lasts from 1 to 3 years. The person with need 24 hours a daily care. The person will eventually become bedridden and become incontinent. Behavior associated with the last stage, loss of ability to remember, communicate or function, inability to progress information, severe disorientation about time, place, and people. Then with travel, then must use non-verbal method to communicate. Many response to may have a less response to music or touch, becomes bedridden. Then the last stage, loses ability to speak, became incontinent, inability to swallow, may become unresponsive. It may sometimes the coma end in disease. The last, it leads to death. The management of problem behavior. Touch is an important method of communicating with the Alzheimer patient. Brain progressing is slow, adopt communication, short sentenced, simple words, repetition. Then bantering. Keep environment safe. Make sure patient gets enough exercise. Distract the person to another activity. Catastrophic reaction. Person overreact to a situation by becoming very agitated, angry, or emotional. Happens because the people has too much stimulate one time. Try to prevent the person from having a reaction if at all possible. Keep environment simple, so do task in simple steps. Stay calm yourself. Try to distract the person to another activity. Sundowner syndrome. Increase in problems behavior as the sun set in the evening. May occur because the patient is tired at the end of the day, or the person may be afraid of the dark. Plan activities for the early part of the day. Hoarding. Persons gather items and hide them. They may forget where they put things and accuse another person of stealing them. If possible, have an extra pair of glasses or hearing aid. Distract the person from worrying about the items so they will not have an catastrophic reaction. Delusion and hallucination. Delusion is equal to false belief and hallucination is equal to false perception. Important, never argue, increase agitation. Hallucination, sensing something that is not there. Avoid direct confrontation. Do not aggress that you see the hallucination or insist that it was unreal. Reassure the person that you are there to care for him or her. Communicating. The communicating strategies brain progressing is slow. Adopt communication, short sentenced, simple words, Repetition. Approach the person with an open, friendly, relaxed manner. Alzheimer patients will mirror your behavior. Do not approach from behind. Alzheimer disease patients need to see your face before they recognize that you are speaking to them. Use short and simple sentence or questions. Ask one question at a time. Speak in a low pitched voice. Use nonverbal clues, gestations, facial expression, pointing, demonstrations. Guidelines for care of patient with Alzheimer disease. Provide a calm, quiet environment. Too much stimulation can cause a catastrophic reaction. Provide a consistent routine. Perform ADLS at same time each day. Avoid changing in routine or environment. Reassure and explain frequently. Do not aggress with the patient. Protect safely. Patient at increased risk of accidents. Eliminate caffeine from the diet. Guidelines for care of the confused patient. Provide activities to distract the patient from inappropriate behavior. Maintain a regular routine. Use patience and understanding. Maintain a calm, quiet environment. Use simple, clear words and sentences. Give frequent pricing and reassurance. Use touch and other forms of non-verbal communication. Use reality orientation. Focuses on safety, routine, emotional comfort, act as an caregiver, as communicator, and protector. Reality orientation helps the confused patient with reality by frequently remembers of who he is or who she is, where he is or where she is, what time is it. Always call the patient by name and identify yourself. Repeat the date, time, and place to the patient throughout the day. Guidelines for care of the aggressive patient. Do not respond in anger. Leave and come back later if possible. Be aware of warning signs of anger such as muscle tension, restlessness, pacing, crying, and loud speech. Offer distractions, communicate and reassure. Be aware of your nonverbal communication. Sit down and you will appear less threatening. Do not touch the patient without his permission. Then, the managing of aggression. Aggression is unmet need. Could be pain, fear, confusion. Identify causes, redirect attention. Finally, the conclusion of our path. Dementia represents a progressive failure of the brain's highest function, ultimately affecting not just memories but identify itself. Among all types, Alzheimer's disease remains the most significant due to its privilege and impact. It progresses through early stage subtle decline, then mild stage behavioral disruption, then late stage complete dependence. Although there is no cure, early detection, supportive care, and compensative management can dramatically improve the patient's dignity and quality of life. So, have a quick review of this Alzheimer disease. We have to keep in mind that Alzheimer Dementia is best understood not as a disease but as a syndrome of progressive cognitive decline affecting higher cortical function. The word aggressive is the backbone of the topic. Unlike acute condition like stroke, dementia begins subtly, progressive slowing, gradually destroying the independence. The non-pharmacological managements of Alzheimer's disease, such as we have to provide them a good diet and we have to make them a good exercise for 45 minutes and we have a balanced diet, example taking greeny vegetables and that all things it's necessary. Dementia is not just a normal part of aging. Aging may cause mild forgetfulness like misplacing keys, but dementia cause serious impairment that disrupt daily life. That's why it is considered a pathological condition, not a natural process. So we have to take these all measures to overcome or to take care of the dementia patients. Many of the drugs are available for treating this dementia. Among the drug, people with a good guidance and caretaker are important. Finally, we are moving to the conclusion part. The overall conclusion for the dementia, it is not simply a problem of memory, it is a progressive decline of multiple cognitive function that ultimately affect the person's independence, personality, and identity. It represents a major neurological change, especially in the aging population. Among the various types, Alzheimer's disease is the most common and clinical significant, characteristic by gradual neuronal loss, formation of amyloid plaque, and neurofibrillary tangles, leading to irreversible brain damage. The disease progresses through three distinct stages: early, mild, late. Although there is currently no defective care, early diagnosis and approximate management can slow disease progression, reduce complication, improve quality of life. Most importantly, care in dementia is not only medical, it is emotional, psychological, and social. Compassion, patience, and structured support play a crucial role in patient's management. In conclusion, dementia is a condition that challenges not only the patient but also caregivers and healthy system. Therefore, we have to provide them a more care and therefore require a holistic, multidisciplinary approach for optimal care and dignity in patient. Despite the absence of a definitive cure, modern management strategies aim to delay progression, control behavioral symptoms, support caregivers, preserve dignity and quality of life. A crucial point to remember is that dementia care extends beyond pharmacological treatment. It provides a holistic approach involving medical management, psychological support, social and environmental modification. From a broader perspective, dementia is not only a medical condition but also a public health challenge, especially with increased life expectancy worldwide. Power enlightening lines, while dementia may gradually take away memories and independency, companionship care and early intervention can still preserve dignity, comfort, and humanity. I repeat, while dementia may gradually take away memory and independence, compassion, care, and early intervention can still preserve dignity, comfort, and humanity. So, we have to take a quick review of dementia. I hope you all understood. Now we listen a small drugs for this Alzheimer disease. The drugs which include donepezil, rivastigmine, galantamine. These uses are mild to moderate Alzheimer. Donepezil is also used in severe cases. The adverse effects such as nausea, vomiting, diarrhea, bradycardia. The eccentric Alzheimer decreases the acetylcholine, give cholinesterase inhibitors. Then the NMDA receptor antagonist drugs are used among them. The drugs like memantine, these memantine block the glutamate receptor, prevents excess